You either die a hero or you live long enough to see yourself become the villain. Every organ in the body can have cancer. Cancer is a heterogeneous mass of mutated cells. Cancer can be cured if it is detected early. Fear itself is one of the impediments for diagnostics. People still have this fear कि मैं अगर वो मशीन के सामने बैठा और मुझे अगर वो कैंसर डिटेक्ट हो गया मतलब it's the end. It is not like that. Chemotherapy or radiotherapy or immunotherapy, breast tissue checkup, awareness campaigns. Poorly functioning cells will create poorly functioning cells. Awareness is the key. It could be the Harvey Two-Face from Dark Knight. It could be the Thanos from Avengers. Cancer is the villain. To somebody who is not from the background of science or research, the body is made up of cells. Each organ has its own set of cells, but every cell has a limited lifespan for which it is viable. It performs its function, and the function depends upon how the DNA, which is present in each cell, orchestrates the expression patterns and everything inside the cell. So let's say we have an industry जहाँ पे एक पर्टिकुलर चीज़ का मैन्युफैक्चरिंग हो रहा है वो वहाँ पे वही होगा. इफ़ यू टॉक अबाउट लिवर सेल्स वहाँ पे मेटाबॉलिक पाथवेज चलेंगे. ब्रेन का चल रहा है तो इट इज़ मोर अबाउट न्यूरोनल communications and all that, but they don't do their functions vice versa. You cannot have liver thinking or you cannot have the brain metabolizing.
Yes.
So every cell has a defined function, has a defined lifespan. You either die a hero or you live long enough to see yourself become the villain. Cancer is the villain, wherein it alters its genetic material, it alters the way the cell behaves and sustains, and it has been categorized into 14 characteristic features in which are existent in each cancer cell. Okay. So the sheer thing that it is able to outlive its own time span because it has those 14 characteristics is what cancer is. So yes, cancer is a epigenetic disease.
Okay.
And people earlier thought that it is only the genetic factor, but now we understand that it is the epigenome, which also something which does not affect the structure of the DNA, but still affects how the DNA expresses, is the epigenetic regulation. So a togetherness of these two features leads to a change in the expression pattern, which leads to a change in how the cell behaves, which leads to overcoming the regulation on the cell or
like
the features of the cell.
Skips the regulation part of the body.
It hijacks the system. And cell has both the features. I mean, if you really go back to Dark Knight, it is the Two-Face.
Oh, yes.
It is the cancer cell is actually a revolt of the body's own cell against the defined properties and functions of the cell.
Like it's that smarter.
It is smarter than anything and everything.
Yes.
And I don't want to just say because I am a cancer cell biologist, but again, not comparing with any other disease and all that, but the sheer complexity that the cancer has, not just at the genomic level, but also at the epigenetic, metabolomic, proteomic, transcriptomic, you name the feature and cancer will have something which is different from a neighboring cell which is performing in the same tissue.
Yeah. Sir, as you mentioned, a cancer cell basically has 14 features, right? Like what is there a name to these 14 features?
So in scientific terms, we call it as hallmarks of cancer.
Hallmarks.
And there have been series of papers on it by great scientists. So the papers are freely available for people to read it. But the features have been based on decades of research. The first paper came in 2000, then in 2011, then in 2022, and every paper or this, you could say, essay of cancer has explained the features which were otherwise available to everyone, but as an essay, so that everybody, it is easier for us to go and read those papers.
Yeah. Do you still think there can be more characteristics
Oh,
yet to
definitely.
explore?
Definitely.
So because cancer cells are
Cancer
evolving.
evolves faster than what the humans have evolved over the period of time.
Yeah, definitely. Smarter to get adaptable to all the situations or
It is
stress.
adaptive.
Yes. So, in the same manner, you already explained so much about cancer, but if we are talking particularly scientifically about cancer, like the depth of cancer, like how does it actually happens and affects a person's body. For example, if I was a person who was very healthy till up till my age 12, but what kind of changes I did in my daily habits or something that led me to cancer, and maybe like how does it actually start in the body?
You can categorize cancer development or the features that lead to cancer development into one which is genetic and one which is non-genetic. Genetic features are passed on from progenies to progenies, as in parents say children, children say फिर उनके children. This kind of cancer, outcome is limited in terms of number of people who have this kind of genetic cancers. So if I have to speak about the landscape of cancer, in genetic cancer, it is about 5% of all.
Okay.
And but this differs from cancer type to cancer type. If I talk
Oh.
about the breast cancer, जिसमें मैं मेरा domain है, about 5 to 10% of the cancer patients they have someone in the family who already had that particular cancer type. If we talk about other cancer types, this percentage varies. So genetics plays a little crucial role. First is that the genetic mutation has been passed on from the parent to the offspring. Second is a predisposition. Like there are certain features called as single nucleotide polymorphisms,
Okay.
which are not actually mutation per se, but there are groups uh, and ethnicities which are present in the population. So there are certain ethnicities which are predisposed to certain kind of metabolic or disorders. So cancer is one of the metabolic disorders. Like all the individuals or majority of the individuals in that particular ethnic group may tend to have that particular single nucleotide polymorphism, जिसको हम SMP बोलते हैं. So that predisposition with environmental exposures creates a very dramatic feature because of which cancer development starts.
Okay.
And third comes unnecessary environmental exposure. Sometimes it is unavoidable exposure. So unnecessary category mein, if somebody is a chain smoker or a chronic drinker, and any type of adulterations for that matter would lead to predisposition to metabolic diseases like cancer. So tobacco, for instance, is known to cause mutations in the DNA. Mutation, as I've been explaining, it's a sudden though heritable change. Heritable in terms of when the cell is dividing, that change in the DNA is passed on from that mother cell to its progeny daughter cells, and from there to the further daughter cells. So this is a heritable change within the cell's lifespan.
And sir, can I say like mutations are random or not?
Yes, they are random.
Okay.
But they are selected for. So let me explain it this way. Every cell, as I've earlier mentioned, it has a lifespan. A normal cell will also undergo mutations, but the mutations are repaired.
Okay.
So a cell is like a vehicle. A vehicle may have a breakdown. So you go to a service center and get the breakdown repaired.
Yes.
Okay. Similarly, if the DNA undergoes any type of random change in the sequence or random change in the structure of the nucleotides, which are the building blocks of the DNA, any such random changes can be fixed. There are a set of proteins called as DNA repair proteins, which actually go to the site of the alteration. They first detect it, they second go to that point, repair it, and then the DNA is ready to be either passed on to the progeny or available for further gene expression characteristics. So the repair can be done Cancer has damages to the repair proteins. So the service center is itself damaged. The vehicle is already damaged. In addition, if the environmental exposures continue to happen, which we call it as insults to the cell, because the cell was not asking for the person to actually go and smoke. But these kind of unnecessary exposures increase the amount of genetic changes that continue to happen. Cancer is not a disease that happens, you know, आज स्मोक किया कल कैंसर हुआ, ऐसे नहीं होता है. It is the extent of exposure to the smoke varies from, I mean, and because of which the cancer development happen, वो जो time span है, it varies from individual to individual. I mean, we have heard case studies of individuals जो 10 years 20 years chain smokers हैं, but they have not developed cancer, but आगे down the line they develop cancer. Some individuals within a year of chain smoking they develop predisposition, or they actually start to have precancerous lesions. So this capacity to tolerate the environmental exposure again varies between individuals. So there is no defined rule that 1 year of exposure is like development of lung cancer. We cannot make that statement. So in case of smoking or any type of, you could say, environmental exposure is always a causative agent in that particular exposure. So when we are talking about smoking, we have nicotine and derivatives of nicotine, and there are even the tar-like compounds which are present in the smoke, which continue to accumulate in the upper respiratory tract and in the lungs, because of which the cells and the tissues, they get inflamed, and they continue to proliferate under such stressed out conditions.
Okay.
So it is like आपकी गाड़ी डैमेज हुई है और आप उसी डैमेज्ड कार को सदियों से यूज कर रहे हो. So at some point that गाड़ी is going to give up.
Definitely.
So it is always about the maintenance. Even if your गाड़ी is really damaged, you need to take it to the service center. Stop.
Yes.
Take a pause. So am I saying that smoking is good? Absolutely not. It is not only from the cancer's perspective. Any disease for that matter, it is like you're inviting the disease to come to you by smoking or by drinking alcohol. I mean, cancer is not the only outcome of drinking alcohol. You have liver cirrhosis, you have kidney failures, you have liver damages to the extent that it cannot be repaired. So it is an invitation you're yourself giving to the disease to happen. So in case of smoking, the nicotine or these kind of compounds, they continue to accumulate at the site of DNA, and within the cells and the tissues, the DNA starts, because if a cell has to thrive and it has to proliferate and create damaged cell को अगर replace करना है, तो you need to undergo replication and cell divisions. With this kind of an accumulation of materials within the DNA and within the cell, the breakdown gadi will continue to proliferate, and it will create breakdown gadis. So cells will, poorly functioning cells will create poorly functioning cells, and that is how cancer development initiates. And what happens in case of cancer is that if you compare the other chronic diseases where the mutation is passed on from one cell to the other, cancer also does the same thing. It passes on the mutation from one cell to the other, but the daughter cell then revolts further, creates new set of mutations which are probably not existent with the mother cell.
It will be different, the mutations.
Yes. So the first set of mutations may remain, and then it adds one more set of mutations. Further divides, creates more copies of itself. Third round of mutation, fourth round of mutation. So cancer is a heterogeneous mass of mutated cells.
Okay.
And when I say mutated, it is not only the genetic material. As I said, the factors which regulate the chromosome to form, which are called as the epigenetic factors.
Yes.
Even they are the activity is altered. So that is why at the beginning I said that cancer is not just genetic, it is an epigenetic disorder as well.
Like even the surrounding is something that affects.
So surrounding in terms of if the DNA has to fold, you need factors which help in the DNA to fold.
Yes.
Okay. So if you are folding a piece of paper, the paper will not fold on itself. You'll have to use your hands and
Yes.
some materials. So that some materials or hands is the epigenetic factors which keep the DNA in place. There are certain regions of the DNA which will never be expressed. Certain regions will be continuously expressed. So again, epigenetic factors regulate this process. If you abrogate even the epigenome, and even if there are no mutations in the DNA, you're predisposing the cell towards certain types of
Cancer.
not cancer, I would say, in some type of conditions. Cancer is, as not said by me, but said by a great author, Dr. Siddhartha Mukherjee.
Okay.
The name of the book is The Emperor of All Maladies, and it specifically talks about cancer is the emperor of all maladies. Maladies is the diseases afflicting humans. So it is the emperor of all diseases.
All the diseases that we have.
It is not because, again, it is written by a person who comes from, has been working on cancer. He's instead of talking about Siddhartha Mukherjee, I would rather say the sheer complexity of the cancer cell is what makes it the emperor.
Yeah. Like the whole complexity, and again, it's adaptable, as you said. So anything happens, it's getting adapted. The mutations are different, as you explained. So definitely, even I can agree to this point that it's the emperor of diseases.
Yeah.
So what all types of cancers are there right now? Because I know there are many types, but which all can you name right now? Maybe like some prevalent cancers in India.
Okay.
And
So first part
worldwide.
of the question is types of cancers.
Yeah.
Technically, every organ in the body is it can form, it can develop a cancer, it can have a cancer, or it can harbor a cancer.
Every other organ.
Every organ in the body can have cancer. So, but then we have categorized it based on what types of cells are involved and what organs are involved. So there are certain cancers which happen on all the tissues related to the skin, and we would call them as melanoma.
Yeah.
Cancer of the lungs, lung cancer. Brain itself has about 50 to 100. I don't remember the exact number, but there are different types of cancers which can happen in the brain, the brain stem, and the central nervous system, and spinal cord, and everything. Then we have the cancers happening in the oral cavity, in the upper respiratory tract, in India. Now coming to what types of cancers are prevalent in India, it depends upon men and women. I mean, that differentiation. So in men, the most predominant or prevalent cancer types is lung cancer and the cancer of the head and neck.
Head and neck. Okay.
So head and neck cancers would have oral cavity cancer as one of them.
Okay.
Tongue cancer. Then we have many other cancers which are associated with the parotid gland and those factors. And in case of women, it is breast cancer is the predominant one, followed by lung cancer, cervical cancer, and so on. So again, because there are differences in the features present in men and women. For example, the types of hormones, the types of exposures. Like men, as I was saying, they invite the process of smoking and exposures to these kind of agents. So that is why lung cancer is more predominant. Chewing of tobacco in India is very prevalent. No matter how many bans the government would impose, there is some or the other way by which people continue to chew tobacco in India. In case of women, it is why breast cancer is because of the sheer types of hormones that regulates the tissues. So we have estrogen, progesterone, and many other hormones whose activity is it's a cyclic change in the activity of these hormones, which is very natural, and it does not mean that ये hormones की वजह से cancer होता है. या फिर इनकी वजह से ही होता है. It's not that way. There is a genetic predisposition, and then comes the extent of exposure to these hormones.
So, but like if we are talking particularly about breast cancer, as you said, that is one of the most prevalent in women. What are your opinions on that? Like, how does breast cancer actually, happens? Maybe like, how does a healthy woman suddenly, if we are not talking about the genetic factor only, because you already explained that genetic does play an important role, but sometimes some cases that I have heard like they never had it in their family, but someone does get breast cancer in their life. But how does that happen?
Okay, but I have referred to the predisposition, which is
Yes.
a little ethnic based. So does that mean that because you're born in a particular ethnicity, you're going to be predisposed? Not really. So that is one factor.
Okay.
The second factor is, I was trying to explain, is the extent of exposure to the hormones within the body. That extent itself is, now instead of let's say 13 to 45, women who have early menarche are exposed from 10 to 45. So the 2 to 3 years increase in the exposure is again a predisposition. The third predisposition is, uh, it's a, I wouldn't say it's bad or correct, but the outcome of it is what I'm referring to, a trend of late pregnancy.
Oh.
So individuals who who have pregnancy beyond the age of 35, according to studies, have a 50% heightened chance of developing breast cancer in the years to come.
Okay.
So that is one of the reasons why parents are really inclined that the children should get married at a particular age group, have kids at that particular age group, and then that ensures that because parents are not thinking from that perspective, but scientifically supported is that whenever the woman undergoes the pregnancy hood, there is changes in throughout the body.
Yes.
Which also includes in the breast tissue. So the reformation, deformation, and further reformation of the breast tissue can be tolerated in a particular age group.
Okay.
Which then subsides after the pregnancy. So breast tissue is one of the dynamic organs or one of the dynamic tissues in the body. So ये अगर पर्टिकुलर एज ग्रुप में अगर रिफॉर्मेशन डिफॉर्मेशन होके फिर से रिफॉर्मेशन होना, ये अगर प्रोसेस मैनेज हो जाता है, then the body can take care of it.
Yes.
If you are going beyond the age group of 35, when the hormonal levels itself are dropping with each year, second is the body is also losing on to certain factors, like we can see advertisements जहाँ पे बोन में कैल्शियम की कमी, फॉर एग्जाम्पल. सो दैट इज द सेलिंग पॉइंट ऑफ सर्टन pharmaceutical compounds.
Yes.
So if they can think from that perspective, these factors are all accumulating and deciding what is going to happen with the person in the years to come. So this is the third feature, I would say. And then comes the stress factor, which we cannot ignore. So there is a big chunk of patients who have some type of predisposition or exposures. And then there is another chunk जिसमें things may not be perfectly explained simply because the randomness of mutations.
Okay. And like, what all precautions should a woman take from this perspective? Like, I would not say to completely avoid, because we can never know. As you said, the mutations are random, but still some precautions that you suggest a woman should take in her life.
First precaution would be every person, men, women alike, should have at least once in a year a full body checkup.
Okay.
This is not just my opinion. The doctors over the world, across the world, they have been suggesting that every individual should be, should at least undergo a CBC, a blood checkup, and depending upon the, you could say, brain में दर्द हो रहा है, so you would go to a brain doctor. Chest में दर्द हो रहा है, you would go to a person who is expert in that. So that kind of checkups need to be done. And especially in case of women, now coming to that, is in the month of October every year we have a breast cancer awareness month. So across hospitals they roll out breast tissue checkup awareness campaigns, wherein techniques like mammography या फिर CT scan या फिर MRI are provided at a discounted rate. So women should really be ready to undergo this kind of tests. There is a lot of apprehension
Yes.
about it. To certain extent, it's really it's really alarming that there is certain types even taboo, even to talk about it.
Yes.
So that needs to be overcome somehow.
Hmm.
I don't know how, but the first thing is people should be readily able to talk about it. आप communicate करना चाहिए, not just with your spouse or with your parents or with whosoever is able to take you through that journey. And it is just a testing. It's not like आपने टेस्टिंग किया तो कैंसर डिटेक्ट हो गया तो अब क्या. You have to undergo that checkup. It helps you to clarify your mind and lead a healthy life further.
Yes.
So the most important thing is a regular screening. When I say regular, it's at least once a year. If some familial factor is involved, then at least once every 6 months.
Okay.
Based on the doctor's recommendations. And the third is most important, I would say, is that earlier we had a thing called as family doctor.
Yes.
That needs to be propagated among individuals. Is one doctor who knows your history, your geography, what are your habits, how do you think, and that is how the moment they look at you, they'll be able to tell कुछ तो गड़बड़ है यार. So that has to be inculcated amongst individuals. So through this medium, I would like to also urge the hospitals across India. It's a request that they should roll out these kind of campus campaigns so that more and more people can come and get themselves screened.
Awareness can be done.
Yeah. So awareness is the key. Otherwise, the type of trend that we have is people present themselves only when it affects their life, and it is an advanced stage in which they come to the hospitals, and then there's this kind of a thing ki treat kar do. It's not that possible when the person presents at an advanced stage. So awareness and overcoming fear and taboo about it are very crucial if you really want to catch the disease in its early infancy.
Early detection. It's important. So we'll definitely continue on this talk. I have more questions, but we'll have a short, we have a ritual of having this fun segment in our podcast, and that is the rapid fire round, which will be taken by our another host, Shri Deepti.
Okay.
She'll be here, sir.
Okay, starting with the rapid fire segment, I'll ask you some fun, light-hearted questions. I want your spontaneous answers.
Okay. I'll try.
Coffee or chai during work hours?
Chai.
Yeah. What's the strangest and most fascinating thing you have observed during your research so far?
Fascinating and?
Strangest thing, anything that was like surprising in
During
your
my
research so far? Yeah.
Surprising and fascinating. Well, I would say the Western blots. And in my era, I would say we had something called as dark room, जिसमें Western blots develop किए जाते थे. So when you start, it's an X-ray film. It's a plain X-ray film, and it goes through a machine where the actual development happens. So what happens out of the machine when the blot actually is developed is the most strange and most fascinating thing.
Okay. What's the most helpful discovery in cancer research in the last decade?
Last decade?
Yeah.
As in 2000 के बाद का, or you're talking about?
Yeah, 2000 के बाद का.
Okay. The human genome that was sequenced, that's the first most important thing that happened. Second is all the discoveries, I would say that you cannot pick one discovery.
Yeah, okay.
But the developments in the diagnostics, especially in the sequencing technologies, have definitely helped to understand the genome of cancer better than what we could.
Okay. Okay. So, early bird researcher or late night thinker?
Late night.
Okay. One sci-fi movie you would recommend?
Again, a very hard pick for me. A sci-fi movie. I would recommend, because I was talking about sequencing.
Yeah.
There is a movie called as Gataka.
Okay.
It was somewhere in the late 90s and early 2000
Okay.
century. So the movie talks about the application of sequencing technology
Okay.
for as simple as identifying the person's identity at the entrance of a company. So instead of an iCard, all you need is you have to present your thumb or some finger at a machine which draws a drop of blood, detects who you are based on certain markers present on the genome, and displays your photo in front of you, and only then the gate is open for
How
you.
interesting.
So yeah,
Okay. If you could swap places with any scientist from history for a day, who would it be?
no, I wouldn't swap places. I would rather sit with them and discuss their journey and discuss uh, the breakthroughs that they have had. So yeah, there have been several scientists who have actually taught us things. So one of my favorite scientists goes to Dr. Rosalind Franklin. Yeah, one person I would rather want to discuss with is Dr. Robert Weinberg, who happens to be one of the people who actually understood the process, one of the people I would say, who described the process of metastasis in cancer.
Okay. Finish the sentence. If you weren't a scientist, I would be.
A writer, probably.
Okay. If you could describe your journey in one word, what would it be?
Ongoing.
Okay. If cancer cells were a villain from a movie, which one would they be?
It's a hard pick for me because it depends upon what feature I'm explaining. As I was mentioning earlier, it could be the Harvey Two-Face from Dark Knight. It could be the Thanos from Avengers. Yeah, couple of my picks.
Okay. If you could cure one type of cancer instantly, which one would you choose?
I would rather want all the cancer types to be, they should be able to just vanish like that. I really want all the cancer types to be vanished.
One book you recommend every student must read at least once.
Depends on what language you want me to say. For that matter, if the person is really wanting to read a Marathi book, I would, for people who are starting to read a book, for them I would recommend Ek Hota Karwar by Veena Gavankar. It's a translation of an English book. And if the person is really wanting to read something about cancer in particular, then we have real good books. One of them is The Emperor of Maladies, which is written by Dr. Siddhartha Mukherjee. But then there are many scientific books which have sci-fi books categories which have been written, and one of my favorite authors is Dan Brown.
That's a wrap on our rapid fire segment. Thanks for playing
Thank you so
along,
much.
sir.
We were talking about breast cancer earlier. So you told us कि कौन से precautions लेने चाहिए in this generation women को, definitely. And I really believe that the viewers who will be watching this, they'll watch and they'll suggest their mother, sister, or anyone for that matter. But if we were to talk about breast cancers, like बहुत से misconceptions होते हैं लोगों के mind में, not even urban cities and all, but whenever I talk with people, I get many different perspectives about cancer, even if they are not from the background of like biologists, they're not studying about cancers, they don't have any scientific knowledge, but they will have some opinions on cancer because everyone knows about it. So misconceptions is something that I heard most of the time. What are your opinions on this? कि like कौन से ऐसे misconceptions है or myths that you feel are very general in this population and they should learn कि these are literally myths, these are lies?
You form an opinion based on what the person has undergone or seen or experienced.
Yes.
Cancer is one of those diseases in which, unfortunately, some family member was experiencing through it. So you have seen the person closely, or you have heard about that person's experience of the journey of diagnosis, treatment, follow-ups, and the factors associated with treatment. So you form an opinion based on that, and that becomes the misconception about it. That's a type of misconception. The second one is we have misconceptions about anything and everything. Uh, Back, I would like to correlate is when the cricketer Sachin Tendulkar had a tennis elbow. Everyone in the country was an expert in tennis elbow.
Yes.
They were suggesting Sachin to have a lighter bat and to use the bat in a certain way. That cannot be the case. So understanding the disease is important before we have an opinion about the disease. So I come from ACTRAC, which is Advanced Center for Treatment, Research and Education in Cancer. It is an autonomous institute under the Department of Atomic Energy and Tata Memorial Center. The tagline for Tata Memorial Center itself is "Cancer can be cured if it is detected early." That is because the advances in the detection systems help in early detection, which in a way reduces the extent to which the patient has to undergo treatment. Because now, let's say the tumors, when I say tumors, if I have to show, it is like you can detect the tumor as small as a peanut, or you can find it as a little larger like an almond, little larger like probably a soybean, a little larger like you can see the gradations in the tumor size. Is because the delay happens, the tumor size also goes hand in hand. So if the tumor is detected early, it's easier for the surgeon to remove that small sized tumor. And then the treatment measures, the further treatment measures like chemotherapy or radiotherapy or immunotherapy, and then there are many other therapies. So the extent to which the patient has to be treated also reduces, and that improves the chances that the patient or the person who is afflicted with cancer will not have a recurrence or a redevelopment of cancer, or requirement of advanced or aggressive type of treatments. So if you're able to detect cancer early, that itself is the first, if it's a chess move, it's the first thing that it's going to help you to overcome any type of damages further. So the myths can be busted once we openly are able to address this concern by not having the fear of cancer. Fear itself is one of the impediments for diagnostics. Even if there are campaigns and awareness programs for cancer, people still have this fear कि मैं अगर वो मशीन के सामने बैठा और मुझे अगर वो कैंसर डिटेक्ट हो गया, मतलब it's the end. It is not like that. So please, it's very important to note that the detection itself needs to be early, and then the treatments itself, the everything, not just the type of treatment or the extent of the treatment, even the cost associated with it reduces. So a stitch in time saves 9 is what I would say.
About early detection, can you tell me, we have detections and the tumors that is formed in the body of human, how different is normal? Sometimes an individual can always have these, not always, they might have tumors, but those cannot be cancerous. Non-cancerous tumors can be there. What's the difference among these tumors, the benign tumor, something?
Yeah,
if
so
you could explain that.
There are two types of tumors. Tumors is a mass of cells which is growing in a particular tissue or organ, जो उस extent पे grow नहीं होना चाहिए था, वो उस extent पे grow हुआ. So it could be a nodule, which grows in size and then continues to grow in size, but Such a tumor can be categorized into two types. One is a benign, which will have a defined growth. So what separates a benign from malignant one is the architecture of the cells, the property of the cells to move from the original location to another location. So that makes the tumor malignant category. If the cancer is able to shed the boundaries and go away from that particular original tissue type and go to another organ, which we call as a secondary tumor or a metastasis. So a benign tumor, if it is removed, the tumor will never come back.
Okay, and that benign tumor is cancerous or non-cancerous?
No, so benign is non-cancerous,
Okay.
non-malignant, and it is an excision procedure which removes that particular group mass of cells from the body, and that's all. Malignant tumors, on the other hand, they have extreme levels of mutations, extreme properties. I'm using the word extreme is because they want to grow in certain way in the tissue, overcome any types of barriers, go away from the tumor, and I keep referring to it, but that's how the textbook also says, it's the colonization, the colonial property to invade something, to go away from your parent location to some other location and start to rule that other location. So that is the colonization, which we call it as metastasis. This kind of properties differentiates a benign tumor from a malignant tumor.
Okay, as you mentioned chemotherapy, right? It's one of the therapy given to cancer patients. Can you elaborate on that point? Like, what is chemotherapy and how important it is for a cancer patient?
So earlier I was referring to that a cancer cell is, if you want, it's a damaged vehicle.
Yes.
So that damaged vehicle did attempt to go to a service center. When I say it did go to a service center, is that DNA repair proteins tried to fix the damages to the DNA. The damages, when I refer, is the mutations, chromosomal alterations, like a fragment of a chromosome detaches from its parent location and goes to some other location. That these are large-scale chromosomal alterations. Or there's even extensive type of chromosomal alterations are the chromothripsis, chromoplexy, which it's little complex to understand, but a chromosome fragments into several sections and attempts to rearrange those sections. Chromosomal alterations, they continue to accumulate in the cell. So you use chemotherapeutic drugs to so what are these agents in the first place? They are compounds which will inhibit the cell replication, cell division, or they will inhibit the DNA replication process. So drugs, for example, like cisplatin, it's a platinum derivative, cisplatin, which goes and incorporates into the growing strand of DNA, and it's like a break in place. Now the DNA will attempt to replicate even in such conditions, and then it will start to probably fall apart, fragment, and the cell, because the DNA is damaged, the cell will be damaged. So cisplatin, we have, depending upon the cancer type, the chemotherapeutic agents they change, but these are the other category of agent is which inhibits, let's say, protein synthesis, or which affects the functioning of a particular type of protein or category of proteins. So we have compounds like gefitinib, erlotinib, which are again given for patients with lung cancer or breast cancer, जिनमें वो particular type of protein is either overexpressed or it is mutated, and so on. These agents are injected into the body. They will reach to all body parts. It's not only that they will reach to the tumor cells or the cancer cells, but the extent that the cancer cells takes up the drug is higher because the cancer cells are also dividing faster. So whenever the cells are dividing, they require more materials, more stimuli. So in that process, they take up whatever is present in their vicinity. So a cell dividing or a cell hyper-proliferating will take up more compounds from outside. That property is exploited in case of chemotherapy. So the chemotherapeutic drug would enter a cancer cell and then sit into the DNA and damage the DNA, and hence the cell will fall apart. The same thing will also happen to other proliferating cells in the body.
Yeah, it is not restricted to only cancer cells.
Unless you actually inject the agent at the tumor site.
Oh.
So, but then if this is, let's say, the tumor, you cannot inject it only into the core. Only the tumor cells is like the center, and then you have rounds of circle around it.
Okay.
So even if you inject the drug directly at the center, it will only damage the center.
Not the
other peripheral cells would be probably the agent will not reach them. So the other way is go from outside.
Okay.
So you can put the chemotherapeutic drug in circulation, and then it reaches the tumor, and the tumor takes it up. And the reason why the chemotherapeutic drug is also affecting the normal proliferating cells is what the side effects that we see. Hair
like
loss,
or
you could say loss of appetite, or fatigue, or vomiting, and general lack of ability to do things, or the motivation to do things. So these are minor things which happen, and then there are of course depending upon the person's ability to tolerate these kind of agents, because depending upon the size or the grade of the tumor, the treatment changes. Now talking about the tumor cells which were treated with the chemotherapeutic agent. So let's say this was the tumor, the peripheral cells start to damage, and the tumor size starts to decrease in size. It shrinks. So chemotherapy can be given before the operation and after the operation. So we say it as neoadjuvant and adjuvant chemotherapy. So neoadjuvant chemotherapy or any type of drug is given so that if the tumor is too large to excise, then you need to shrink the tumor, bring it to a size which the surgeon can remove without damaging the neighboring tissue.
Okay, so shrink in the size, the cells will die,
yes,
right?
The peripheral cells
die.
And that is why if this was the mass of the cancer, it is reducing in size and becoming only this much.
Okay.
Hypothetically. So then it is easier to, instead of removing this entire chunk from the body, you remove a small size, increases the stress on the body. So the person अब naturally भी देख लीजिए chemotherapy वगैरह side में भी रख दिया, you are having too much of stress on the body starts to give way for the pain.
Like how the treatment is done and everything. There's also a concept of resistance, getting resistant to the therapies or whatever this treatment that we are taking. It also, I've heard that happens with chemotherapeutic drugs that is given to a patient. How does that happen? Like, how does a patient get resistant?
Condition called as senescence or quiescence, in which they're actually sitting quiet, they're not proliferating.
But they're still alive.
They're alive. So they have shut down all the machinery and they're sitting just quietly. Because there is a lot of stress of chemotherapy and radiotherapy and all that. So these cells, because they have gone into that quiescence, they will, even if the chemotherapy is given, the cell is not proliferating, the cell is not ready to take anything from outside. Then for a brief period of time it stays like that, even after chemotherapy, and then it comes back with a bang. And that bang sometimes makes the cancer a little more proliferative, a little more aggressive. But does that mean that every person who has cancer will have this kind of a feature? Not really. Does that mean that a certain treatment would lead to recurrence or resistance? Not really. Again, it is sometimes a matter of escapism of the cancer. Cancer has already escaped from one location to the other, and all the protocols are not able to detect it. So now, let's say in the neighboring lymph node the cancer cells have gone, they continue to proliferate after the chemotherapy stops.
But after some months, years?
Yes. So that, leads to recurrence. At the same time, now if you treat that individual with the same chemotherapeutic drug, it may not work because cancer has already evolved. ये तो हुआ
Changed.
कि एक जगह से दूसरी जगह पे. Then there is something called as उसी primary location पे we have cancers as a heterogeneous mass.
Yes.
Earlier I was referring to that the mother cell proliferated gave rise to 2 cells, 2 to 4 cells. At every round of cell proliferation, cell division,
Different.
probably there are more mutations that the cell is taking up, or it's developing in its genome, which makes this cell not responding or not unresponsive to a particular chemotherapeutic drug, which would have worked for the first cancer cell or a neighboring cancer cell. So out of 100 cancer cells in a tumor, in a malignant tumor, maybe 90%, 99% of the cancer cells responded to the chemotherapy, except that 1% or 10% of the cells who initially responded, but then they were able to overcome that stress. And they then adapt and go into resting or hiding. So you remove rest of the cancer cells, or probably you don't require to remove because the tumor has already shrunk on the PET or MRI. And then the cancers which are now resistant to that particular chemotherapeutic drug would outgrow. So then the person comes back with the cancer. You further undergoes rounds of detection, and then they come to know that the cancer is now aggressive. So it does not only have to do with chemotherapy or radiotherapy. Resistance can be developed to immunotherapy, hormonal therapy, which is also called as endocrine therapy. And I have been working in the field of steroid hormones, how they affect the cancer cells, or how they can be, the receptors which respond to the hormones, how they function, and what measures can be taken to, allow us to utilize these receptors and hormones to overcome cancer. So my PhD work was on understanding how progesterone works on breast cancer, and I am continuing in the field of breast cancer for my research. But of course, if the cancer cell biology is understood, you can, also I'm working on, for example, oral cancer. So you need to first understand the biology, and then you would be able to take the research further.
So as we are already talking about being a cancer cell biologist, you have been working in this field for a long time now. What kind of advice do you have for some students, like the viewers who will be watching and who have the interest and who wants to be a part of this cancer, like to study cancer, like early stage cancer and all? So what kind of advice you have to these students? How can they start with their career in this field?
First thing is patience.
Okay.
Second is curiosity, and it cannot be one day curiosity, it has to be a sustained curiosity. For example, I wouldn't say that I have understood cancer completely. No one can say that. So you have to be curious enough to explore further.
Okay.
So these features are important. They form the baseline. Second, at the education perspective, we already have certain topics in place. Any university or any undergraduate, postgraduate courses in life sciences teaches students topics like cell biology, molecular biology, genetics, genomics, transcriptomics, and everything like that, synthetic biology and everything. You should be able to utilize those concepts, and then if really you want to have a career in cancer, then you need to put those things into perspective and start to understand cancer. I'll keep highlighting that a person needs to first understand the disease before you actually explore or you want to venture onto it. Third thing that can be done is having a separate subject which talks about the disease biology. So topics like cancer biology or chronic disease biology, these need to be there in the universities, if they really, universities or institutes or colleges, so that individuals who are really wanting to go in this field would have bare minimum understanding of the disease biology before they actually go on to work on the disease, because you need to have a problem statement for PhD, which is not like, I have this problem statement, I want to work on it. It also has to align with your mentor's thought process. So it is more of a arrangement that the PhD student and the guide reaches to, and then you go further with the problem statement to deduce it. We should not rather go to prove a hypothesis. We should go to, disprove the hypothesis. Then you have to say that no, this is not the case, and then go on to do experiments which will disprove your original understanding that this was wrong.
Oh.
If I go with the hypothesis that this is right, the problem statement was correct, then I'll do experiments which will prove the hypothesis and I'll be done. But then you would not understand the nuances involved. Because let's say you're hunting down onto, or you're really trying to understand how a mutation in a particular part of the gene is leading, or it's regulating the activity of the protein. So mutation happens in the DNA of a particular DNA segment of a gene, which leads to a change in the amino acid composition, which leads to a change in the structure of the protein and the way it functions. So you're wanting to study this, but you design experiments only against that particular one mutation, but you're completely ignoring how that one mutation is actually changing the protein's structure or its function.
Okay.
So you're able to tell or understand the mutation, but the factors after it, the outcomes for it. So you have to first question at each point. I'm giving just one example. Gene expression is a little more complex. Studying mutations is not also very easy. It's extremely difficult. You need to understand from 3.2 billion base pairs that one nucleotide was different itself is a task.
Yes.
So that one nucleotide, you need to compare it with other genomes in the database, and then make a call that this is actually an altered base and it is not an artifact.
Yeah.
So that's why I was in the previous segment when we were talking about the which technology is something that I would really say that this is an important thing that has happened. So sequencing technology has helped us to understand the genome better.
Definitely.
And day by day it is given, simplifying the process, because the technology has become complex.
Yes.
More complex the technology, more simple the answer that it will provide. So genome sequencing has extremely been playing an important role. But you should understand all angles of the problem statement that you have before you actually go on. So it all starts with your curiosity, your patience, and then goes to the next level is to put things into perspective and then continue to research without feeling that things are not working. Okay, things will never work. You have to make them work.
Yeah,
So
definitely.
that's the perseverance is also important.
Like sir, now all these things that you mentioned right now, ये सब cancer cell biologist or cancer researcher will be studying. Then how different is cancer oncologist?
So oncologists, or we could say medical practitioners or clinicians who are really they're working for treatment of patients. So researchers are exploring mechanisms. Oncologists are actually treating the patients. Okay. So we have clinicians who give treatments in terms of medicinal treatments. So they are said to be medical oncologists. Then we have individuals who actually excise the tumor, and they are oncosurgeons.
Oh, even that is different.
Yes. So a medical oncologist would be MD.
Okay.
And then they have specializations. Oncosurgeon would be MS.
Oh.
So they are master in surgery, master in medicines and all that. So वो अलग-अलग perspective से they are able to address cancer.
Oh.
And then it's really good thing that we have individuals who have uh, the background of medicine also entering research, and really inspiring, you could say, thing that they are, we call them as clinician scientists, because they have a great background of the medical perspective. They are probably surgeons by training or medical oncologists by training, but they have a problem statement.
They want
They
to
are
explore.
meeting patients day in, day out. They know exactly what works, what doesn't work, and then they define a problem statement and they go on to disprove it.
Okay.
So they have a training, a PhD holder or a PhD and a postdoctoral person, and then a researcher has the other side of it. They are thorough with the mechanisms. They understand biology. Does that mean that the clinician does not understand biology? They do.
They do.
But at the cellular level, at the molecular level, these researchers or the scientists, they are well versed. And then when they collaborate, sit together in a room, and then they together define a problem statement. That is, it's the great combination for a researcher and a clinician to sit together and design a problem statement.
Definitely. My last question, as we have a restriction of time and all, my last question would be like, is cancer curable?
I think the simple answer to this is cancer can be cured if detected early, as I said earlier also. But curable के लिए first thing is we have to be self-aware. We have to undergo those yearly scans, and then we also need to have a healthy lifestyle. When I say healthy, is avoid high fat, high calorie, high sugar diets. Exercise regularly, if not daily, at least regularly. Have some activity. Sedentary lifestyle needs to be overcome, and then prevent exposures, unnecessary exposures to tobacco or smoking, tobacco chewing or tobacco smoking, alcohol, and any types of narcotics, for example. Then somebody would say that I have never smoked, but still I developed lung cancer. It could be because of passive smoking, where you are not smoking, and then you as in the person is not smoking, but somebody in the vicinity is constantly smoking, or you are at a place where there is these nicotine-like compounds or any type of irritants present in the atmosphere continuously. So you are inhaling that particular substance day in, day out, and that is making the further process for it. So if you are able to avoid all these features, are able to take care of your health, and also you're able to reach to the hospitals and clinics and have an open dialogue about these things, and if cancer is detected early, then yes, it is curable. It is not a full stop.
Okay.
And even if it is not detected early, but there are several factors in place: the age, the type of body architecture, and the person's physical ability to tolerate the medications and the surgical things. So ये बहुत सारी चीजें मैटर करती है. It's again, one size does not fit all.
Yes.
So what really did not work for one person does not mean that it will not work for the other person. So cancer is curable, but for that every individual has to be self-aware and then follow these kind of things.
Thank you so much, sir. Definitely people who are watching this, I feel they'll definitely get inspired from you.
So yeah, I had the great opportunity to have a great conversation with Team Adaptiv, and please do like, share, subscribe to the Adaptiv's social media platforms, and do keep listening to Adaptiv. We did have a great conversation on cancer, and there are many more topics, I'm sure, which the Adaptiv will be having.